Joining us now, a women's health specialist and author as well, Dr. Anna Cabeca. Anna, did I pronounce your name properly?
You absolutely did. Good morning. How are you?
Good morning. I'm doing great. Thanks for being with me. I appreciate you. So you're seeing a trend here. I guess research shows that women are deciding not to have babies because of the pandemic. What's going on?
Well, there's a few things, and I think that the women are fearing the uncertainties of the pandemic for sure. And so there's that deciding to delay prep, as well as our fertility clinics. Like if we need fertility treatments, the fertility clinics are seeing over a 90% decrease in clients coming in because there's that uncertainty as well as the risk of exposure to coronavirus and how that plays out in pregnancy or for children. And I think, too, just to tag on to your earlier conversation, uncertainty of the economics, our financial situation in the future and how that's going to play out as well.
Yeah, it's amazing to me. And you're a doctor. I know coronavirus is ugly. And yes, people have died from this. But my gosh, people die from the flu every year as well. And we've also seen with coronavirus that children seem to fare much better than any other age group around the world. So is it the mass media that's painting this fear of doom and gloom with coronavirus? It's scaring women into not doing this? Or do you think these decisions are based on fact?
Well, I think there's a lot of fear and uncertainty around it. So that uncertainty and the stress is also laying into fertility. The more stressed we are, the more issues we have with fertility. And that's true. That's true for both male fertility and female fertility. And I agree with you. I think that we're recovering very well from coronavirus overall. And we know how to take care in the medical community. We know better how to take care of patients. Mm-hmm. In early infection as well as late infection if they need oxygenation. We know this a lot better. So patients are recovering, quite well overall. Yeah. So we're seeing this improvement in care. And so I do think that it's just the fear, the uncertainty, and of course, the hype, just how that can affect us, the stress of everything during this season can affect our fertility.
I think that you make some great points. My daughter and her husband both had coronavirus and battled through it a little bit, but they're over it now. My son and his wife also had coronavirus. My daughter and Chase, her husband, have two kids, Sophie and Charlie. They're 2 and 4, two little girls. They never got it, or at least they never showed any symptoms of it. The economy, extremely strong under this presidency until the coronavirus event hit. And then with the government locking us down like we've never done before in this country based on disease, there goes the economy in the toilet. But we've seen the bounce back and the recovery on this. So I think, deep breath, folks. It is very stressful, and that does play into getting pregnant. There's no doubt about that in fertility. But I think the facts remain here that the economy is strong right now. But despite coronavirus, and we, like you said, doctor, are finding better ways to deal with it, and the facts remain that children, are better suited to deal with it than, older folks or more compromised immune systems. So I hope we get back on track and people de-stress after this whole madness of 2020 is over, and everybody can kind of get some semblance of normalcy and, back into the way we love it to be these days. All right, doctor, thank you so much.